Why can't I get pregnant? Why some women don't get pregnant? These two questions many women are always asking. Is this case normal or not? There are many possible reasons why you aren't conceiving, including ovulation irregularities, structural problems in the reproductive system, low sperm count, underlying medical problems, or simply not trying enough. Let's first start talking about infertility. What is infertility? Infertility is defined as the inability to conceive. For women with male partners, this is after 1 year of unprotected sex when under age 35 and after 6 months for women 35 and older. What causes infertility? Both men and women may have health conditions that affect their ability to create a pregnancy. The infertility evaluation may help determine the cause of infertility. However, for about 1/3 of couples who are infertile, the cause is unknown. Reasons you may not be getting pregnant. Not trying long enough. The first thing to consider is how long have you been trying. It may feel like you've been trying forever, and maybe you have, but it's important to know that many couples don't conceive right away. About 80% of cisgender, heterosexual couples conceive after 6 months of trying. Approximately 90% will be pregnant after 12 months of trying to get pregnant. These rates assume you have well-timed intercourse every month. When to call a doctor? See a healthcare provider about your fertility if you're 35 years or older and have been trying for at least 6 months. You're younger than 35 and have been trying for at least 1 year. The second reason is ovulation disorder. Human conception requires an egg and sperm. If you're not ovulating, you won't be able to get pregnant. Sometimes women don't ovulate regularly, which is the process of the ovaries releasing eggs for fertilization. Infrequent or missing periods may be a sign of polycystic ovary syndrome, PCOS, hormonal imbalances, stress or a low body weight. Obesity can also lead to ovulation problems. The third reason is fallopian tube obstruction. Blocked or scarred fallopian tubes that prevent sperm from reaching the egg are a frequent cause of infertility. A history of pelvic infections, sexually transmitted diseases or endometriosis increases your risk for fallopian tube obstruction. Uterine abnormalities and endometriosis. These two conditions may prevent you from getting pregnant. Some conditions make it difficult for a fertilized egg, embryo, to attach to the uterine wall. Endometriosis is when endometrium-like tissue, which is the tissue that lines the uterus, grows outside of the uterus. It's estimated that up to 50% of people with endometriosis will have difficulty getting pregnant. The fourth reason is underlying medical problems. Underlying medical conditions can lead to male and female infertility. For example, a thyroid imbalance or undiagnosed diabetes can cause infertility. Some autoimmune diseases, like lupus, can cause infertility as well. Mental health conditions like anxiety and depression are also associated with infertility. Reason number 5 is certain medications. Some prescription medications that may impact fertility. For example, research has shown that taking some antidepressants makes it harder to get pregnant. The sixth reason is male infertility. Fertility issues do not just happen to the person intending to carry the baby. In 20% to 30% of infertile male-female couples, the male partner has a fertility problem. Another 40% of couples have infertility factors in both partners. Male infertility rarely has symptoms that are observable without a semen analysis, which is a test that measures the health of the semen and sperm. The seventh reason is lifestyle factors. These include smoking tobacco, excessive alcohol use, and illicit drug use, such as cocaine, ecstasy, ketamine, and amphetamines, can contribute to fertility issues. Additionally, living with extreme or chronic stress, experiencing trauma, or having insomnia and other sleep issues may reduce fertility. Being significantly overweight or underweight is also known to disrupt fertility. The last reason is unexplained infertility. Between 10% and 30% of infertile couples never find out why they can't get pregnant. This is called unexplained infertility, or more accurately, lack of good diagnosis. Many doctors make the point that there really is no such thing as unexplained infertility, but only undiscovered or undiagnosed problems.